Good evening, everyone. We are just waiting for the final panelists to join us, and we'll be starting very shortly. Kindly bear with us for this slight inconvenience.
Dr. Mohan is having trouble joining us.
Yes, I can see that. I'm just trying to figure out troubleshoot it.
We have under 19 participants.
Yes, ma'am.
Yes.
Hi.
Evening.
Hi, how are you, Dr. Sareen? So good
I'm
to see
fine. Yes, very nice to see you and see you all. Are we in time for the meeting?
Yes, absolutely. Dr. Mohan is just having some trouble logging in, but I think, and we are also waiting for Dr. Tom O'Brien from Costa Rica to join us. And one of your biggest admirers is your nephew, Arvind. He speaks so warmly and affectionately about you.
Well, thank you. Thank you so much. So we wait for some more time. You'll give me a call.
Yeah, we just.
Okay. I am on the line. I'll just finish something, and then the moment you give me a call, I'll join you.
Yep, absolutely.
Okay, all the best.
Just
Anju ma'am, I'm going to start now. Is that okay?
All good, yes.
Good evening, ladies and gentlemen. Welcome to the 6th episode of wheat-related disorders. Today, we're going to touch upon wheat-related disorders and liver disease. We're meeting here after almost 2 months, and it's been a big gap, but I believe we'll be on track and be covering several other symptomatic diseases as we go through the year. We have with us a very eminent set of panelists today, Dr. S.K. Sareen, Dr. Arvinder Soin, and Dr. Neelam Mohan. Joining them, of course, are our regulars in the group, the ones who spearhead this entire drive, this movement. Dr. Dang, our moderator, Mrs. Ishi Khosla, Delhi's leading nutritionist, and the soon to join us, Dr. Tom O'Brien. A short introduction to our panelists, who otherwise need no introduction, given their illustrious careers and the work that they have done as medical practitioners. Professor Shiv Kumar Sareen is a senior professor, hepatology, chancellor and director of the Institute of Liver and Binary Sciences in New Delhi. He was instrumental in setting up the ILBS under the auspices of the government of Delhi, and is also the director of the WHO Collaborative Center on Chronic Liver Diseases. He has a long and illustrious career behind him, and nothing I say would do justice. But he also developed, along with other board of governors, the Vision 2015 document for medical education in India, as his tenure, during his tenure as chairman of the MCI. He is joined today with Dr. Arvinder Soin, who is the group chairman and chief liver transplant surgeon at the Medanta Institute of Liver Transplantation and Regenerative Medicine at Gurugram and Lucknow. Our third panelist today is Dr. Nila Mohan, Senior Director, Department of Pediatric Gastroenterology, Hepatology, Liver Transplantation, and she is associated with the Medanta Medicity in Gurgaon. They're joined by Ms. Ishi Khosla, founder director of the CSI, and our moderator for the evening, Dr. Arjun Dang, CEO of Dr. Dang's Laboratory in New Delhi. We also have with us Ms. Radhika Mehta and Ms. Tirath Mehta, who will be talking about their experiences and treatments as they have gone through this as proper case studies when we go through this particular panel discussion. I now hand over the forum to Ms. Anju Khosla on behalf of the CSI. Over to you, ma'am.
Thank you, Arjun. And on behalf of the Celiac Society of India, I'd like to extend a very warm welcome to our esteemed panelists and audience to the 6th episode of our 12-part series on the various manifestations of wheat-related disorders. For those of you who may have missed out on the earlier webinars, you may access the recordings on knowwewell.com, our regenerative whole health partner. I also urge you to visit our website, celiacsocietyofIndia.com. Drop in a message if you have a query, or become a member of the society to get to know about the various activities and events hosted by the society in continuation of our mission to increase awareness on early diagnosis and management of celiac disease and wheat-related disorders. We also publish a quarterly newsletter called Wheat Views, which may be of interest to you. Later on this year, we will be hosting the 2nd edition of the International Symposium on Wheat-related Disorders. So do stay tuned in. Thank you once again, and I'd like to now hand over the platform to Dr. Arjun Dang to set the ball rolling. Thank you.
Thank you. Thank you so much, Anju, and thank you, Arjun. And a pleasure as always. And just before I start, I have a very cool and interesting thing that happened today, was that our social media handle started blowing up as soon as we put the poster about this event. And obviously, Arjun, I completely agree with you that words aren't enough to actually give an introduction to Neelam ma'am, Soin sir, and Sareen sir. And it's an absolute honor and privilege, and looking forward to this crash course of 1 hour in which we are going to learn a lot of things. So without much ado, I have a quick introduction to the topic for our viewers essentially, and then we'll quickly jump into our questions as well. And so good evening and a very warm welcome to everybody who's tuned in today. I promise you an hour of very exciting interactions and also a lot of questions. I have one request to everybody, including the panelists and the attendees as well, that if you have any question, comment, or anything, just note it down or raise your hand while we are discussing, and I'll try and get back to you quickly. For the attendees, we've kept some time at the end of the session, so we will be addressing all the relevant questions. So just keep in mind, and we'd like to address everything that anyone has a query about, so we will certainly try our best. So quickly giving context and moving to the questions. So in recent years, there's been an increasing prevalence of wheat-related disorders such as celiac disease, non-celiac gluten sensitivity, which are characterized by an abnormal immune response to gluten, a protein that is found in various grains like wheat, leading to inflammation and damage to the entire GI tract. Now, recent research has suggested a possible link between these wheat-related disorders and liver conditions. While the exact mechanism and underlying this association are not fully understood, it is believed that chronic inflammation caused by wheat-related disorders may play a role in this. However, emerging evidence suggests that wheat-related disorders, especially celiac disease, may also contribute to liver damage and increase this risk of liver disease. In this panel discussion, we will explore the latest research on wheat-related disorders and liver diseases, their underlying pathogenesis, mechanisms, and the implications that are there for clinical practice. We have with us stalwarts, luminaries, celebrities, whatever you want to call it, but in the field of liver diseases, gut health, and nutrition, from whom we would like to have an in-depth discussion on wheat-related disorders and liver diseases. So quickly jumping to my first question, do we have Dr. Tom here? Has he joined here?
I think
Okay.
I think he got the time wrong, and he's
Okay.
a little delayed.
No worries at all.
Yeah.
So we'll start with Sareen, sir. Hi, good evening, sir. Sir, so researchers have found and are of the view that patients with celiac disease should have their liver enzymes routinely checked, and they should be treated with a strict gluten-free diet. So do you believe that patients with liver disease should also have their food sensitivity and celiac disease testing done? And also, we would like to know your view on the connection between liver diseases and wheat-related disorders. Thank you.
So there are three parts. First, you asked whether celiac affects liver, or a patient with liver should have a test for celiac and the approaches for management related to it. So the patients who have got celiac certainly can have liver involvement. Celiac makes the breach in the intestinal wall or permeability. It permits the toxins and the bacteria to sieve through. It can actually facilitate in a way because of the poor intercellular junctions. So once these toxins or cytokines reach there, it can be damaging the liver. I must tell you, many of you may not know that the TTG test was a serendipitous discovery. It was not meant for celiac. The guy, Detlef Schuppen, a very dear friend, he was working on, he's a German working on liver disease. So he was working and he was doing proteomic studies for liver to find out what are the possibilities, which proteins can give the liver disease in a non-viral. So in the non-viral scenario, he came across TTG. And then this TTG became, that was a science paper, became that yes, you can diagnose this and it can affect. So there is a basis of relation of TTG and patients who have got celiac disease patients or TTG positive to have liver disease. The second part, do patients with liver disease should get their tests for celiac or wheat allergies and others? Certainly, there is a good rationale, but I'll put 3 or 4 conditions. First, TTG alone is not so specific for this. So we must, anybody who you have a suspicion like unexplained rise in enzymes, or the patient has fatty liver disease and you have no fat in the liver. So you've done ultrasound or elastography, but there is no fat, but the enzymes are high. He's a lean thin. You would like to do this. And in such patients, first do TTG if it is positive, and especially more than 5 times. Then I would like to do an endomysial antibody EMA test. If the EMA is also positive, then you go for a biopsy. It is very important for those who take biopsies that their biopsies are from D1 as well as D2. So minimum of 6 biopsies, D2 4, D1 2 must be taken. And then classically, you must have more lymphocytes. So 3 level of testing. Why is it necessary? Because many patients with liver disease themselves can have scalloping and can have changes which look like celiac disease. So I think it is important that we have an index of suspicion, but a very high index for specificity. At least 2 antibodies should be used other than TTG. And the enzyme rise should not be more than 5 times. If it is more than 5 times rise, then I would say that this is not celiac. And more importantly, as I'm sure you will come to it, when you stop wheat, the enzymes must come down.
Thank you. Thank you, sir.
answer?
That's yes, yes, sir, certainly. So very, very clear and very, very well explained. Thank you for that. So, and Neela ma'am, coming to you next. And thank you for being here. And ma'am, so essentially, I have seen that in some of your cases, you do suggest food intolerance test or a food sensitivity test, especially in the pediatric age group. And any specific conditions where this indicated, and do you feel that there is a certain connection between food sensitivities and the various liver conditions and the GI conditions that you manage?
Yeah, I just wanted to add a couple of things Dr. Sareen explained so beautifully, and I learned about this, about Chopin, which you were saying, which I didn't know that it was actually being done for liver. So that was a very interesting thing. Thank you for that information. So what, continuing with that, and I'll answer that question, is that in children, how do we approach is, we look at non-specific transaminitis, which is when you have abnormal liver enzymes. So when you do a battery of tests to see the abnormal liver enzyme, always we do the TTG-IG antibody as a screening test. And in India, because of issues, though anti-endomycin is good, but because it's an immunofluorescence-based test, and it is a lot dependent on the observer who's seeing rather than an ELISA like a TTG. So in India, we rely a lot on the TTG, which is an ELISA test, and then confirmatory. We don't always get anti-endomycin because for some reason, most of the labs, we're not very comfortable with it. We end up doing a biopsy to make sure that collaborate with it. So that was one. And second thing is that even if I diagnose celiac disease, so the liver is going to be affected, what we call as the celiac hepatitis. That means in which there is either a non-specific transaminitis and liver biopsy showing some inflammation or fibrosis. And the second thing is autoimmune liver disease, which is associated with celiac. And that I have, I think, a dozen patients where we have proven autoimmune liver disease in them. So that doesn't stop a celiac patient not to have associated, like 4 to 8% we know can have other autoimmune diseases. So keep that in mind. And we don't see so much like the adults talk about the primary biliary sclerosing, cholangitis, etc. They see probably a little more at that time PBC than we see in the spectrum. And the third condition is that, celiac is 1 in 100, as you started saying. So there could be something else. The patient could be a Wilson disease, the patient could be a NAFL, the patient could be a hepatitis BC, and yet have celiac. So that is called as celiac with associated other liver diseases that we need to keep in mind. So I like to, and from purpose of teaching, like put it into 3: celiac, hepatitis, associated autoimmune condition, and other liver conditions which are associated and you detect. Coming back to your question, so when we talk about wheat-related disorders, as you all lovely put it across, we divide them into 3. So one was the autoimmunity, which is the celiac disease, and the second is the allergic part, which is the one which you're talking about, the sensitivity. And the third is the immune-related, what we are talking about, the non-celiac gluten enteropathy. So if I divide that into 3, the center part, which is the wheat-related allergy, that could be either in the gut or in the skin or in the respiratory tract. So that is why sometimes we do like to see that is there any this allergy test that you spoke about, and it's a big Pandora, and outside the discussion of this, whether we do the IgE, whether we do the IgG, but the truth is, yes, skin prick test is most reliable if you're thinking of an IgE based test, and the IgG based test, still it's like a gray zone, and you treat 10 and 2 really respond and 8 don't. So it's like that. But I grossly divided why I need to do. It's not exactly the celiac, but the allergy component to the protein in the wheat that you look up.
Thank you, ma'am, for that, and well noted. My next question is to Dr. Soin. Sir, are you here with us?
Yes, very much so.
Hi, sir. Thanks for being here. And sir, my first question to you is that there has been a lot of discussion about non-alcoholic fatty liver disease and its association with celiac. A systemic review and meta-analysis from this year puts the number as 1 in 20 people with cryptogenic cirrhosis who also have celiac disease. How can we explain this association between liver disease, especially non-alcoholic liver disease, with wheat-related disorders?
So, Arjun, part of the answer has already been given by my colleagues, Dr. Sareen and Dr. Neelam Mohan. Basically, there is a clear association between liver disease of various types, both NAFLD and autoimmune disorders and celiac disease. Dr. Neelam already said PBC, PSC, autoimmune hepatitis, these are all associated with celiac disease, as in they both have higher incidence of each other in the presence of one. NAFLD, of course, what happens with NAFLD is that, like Dr. Sareen spelled out, celiac disease basically upsets the intestinal permeability, and there is extra accumulation of fat in the liver, to put it, in a layman's language. And celiac disease predisposes to NAFLD, and NAFLD also predisposes to celiac disease. This is all very well known. And whether the factors are 1, genetic, 2, diet-related, and 3, immune-related, or a combination, and I suspect it's a combination of all 3. So that's how they're related.
Great.
I think would be the microbiota. Dr. Sareen would be truly excited if I say that, because I heard this talk where we are talking about how the microbiota has an influence, because 70% of the blood circulation, portal vein which goes, is feeding through the gut. So that itself is supposed to be having an impact on your fatty liver disease. And of course, the celiac is also associated with autoimmune like diabetes, etc. And that itself can give rise to fatty liver disease. And malnutrition can give rise to steatosis. So you've got to take with a pinch of salt, as Avi said, it's like both. So all patients whom you have steatosis based on the fibroscan, you won't jump to call them fatty liver if there is an underlying celiac. You're going to first treat for the celiac, see whether it reverses or not. If it doesn't, only then you would call it NAFLD or MAFLD nowadays, what we like to call the metabolic associated fatty liver disease. But it should only be said once you've given a trial and shown that there is no response. Dr. Sareen can comment. Is that what I said?
Yeah, you've really taken it right. I think it's influence of the type of food and wheat that influences gut, but there is a lot of genetic basis and inheritance which comes with celiac. So, but one thing which I wanted to say, and maybe you all would comment on it, it's a chicken and egg story. What has come first and what has come later? To say that wheat or gluten or gliadin causes liver disease is a very difficult thing. We can say there is an association. And whether autoimmune liver disease has a message from the bowel is also very difficult. I'll simplify this, because the intraepithelial lymphocytes, once they are exposed, for everyone, this is simple. The lymphocytes in the bowel, once they are exposed, will go to the lymph node. The lymph node will circuit it through the liver, because you have to produce T cells. So the T cells are produced in the liver. And these T cells go back to the lymph node or go into the circulation. So the injury can be, you will have local injury, you will have injury at the site where intestine is, and you have large lymph nodes. So whether it is celiac per se or any other, so in NAFLD, there is a leaky gut. there is a large lymph node, and there is a liver injury. And that is simply because of fat and simply because that you have a leaky gut. So NAFLD or MAFLD and celiac, they share the same thing, except in MAFLD, you will not have any intestinal injury, which is visible. And in celiac, you will have injury. So finally, it is a leaky gut. Sometimes you have chronic alcohol, it can also give you the same picture, fatty liver, endotoxins, and a false positive TTG.
Thank you, sir, for that. Completely agree with that chicken and egg story, and again, very beautifully explained. So I see that Dr. Tom has also joined. Warm welcome, Dr. Tom.
Thank you so much.
So I would like to go to your question, and we started because we were waiting for you. So just to set the stage for the topic and the connection between liver diseases and wheat-related disorders, if you have anything to say about that, and then we'll proceed with the rest of the discussion.
Oh, thank you. Thank you so much. I think for the general public, one of the most important concepts to understand is that your liver is the oil filter in your body, that it cleans the blood. And whenever we eat anything, no matter what it is, when it goes down the tube, into the stomach, into the intestines, and it begins being broken down and digested, and it gets into the bloodstream, the only place it can go is to the liver. It cannot go anywhere else because the liver has over 500 functions, but one of them, an important one, is that it's the filter in your body. When you drop an apple on the ground and you pick it up and you wipe it off and you eat it, if there was some dirt on that apple, now it's in your intestines, now it gets in the bloodstream, it goes to the liver. And your liver is like a beehive. It has hundreds or thousands of little cells. And each of those cells is lined with a screen that only lets really small particles go through the screen. So the oil filter function of the liver is one of the important functions to protect the rest of our body. And because of the diets that most of us have grown up on, with the wrong kind of fats and too much sugar and many other prepared foods, the liver gets dirty. You get a dirty oil filter. And that's where the entire concept of detoxification first came into being a few hundred years ago, was to clean the oil filter. So the first step in that process is to make sure you're drinking enough water. Water is the filtration liquid in the body. You can't move the garbage out unless you have enough of water to carry it out. And for an individual, I'm sorry, I don't know the measurements in India, but in the US, for every pound that you weigh, it's 1/3 of an ounce per water. And I'm sure someone can translate that into the measurements in India before the end of our show here. But it's 1/3 of an ounce per pound body weight. That's the minimum amount of water we need every day to help our oil filters flush out all of the debris that it's catching. And I'll pause there. I think that's an important concept to understand, is that it's your oil filter. It's there to protect you.
Thank you, Dr. Tom. So we'll certainly remember the oil filter comparison, and it's a very good way for the general audience also to understand that. Thank you for that. So quickly moving on to Dr. Sareen also. So Dr. Sareen, autoimmune hepatitis and non-alcoholic liver disease have often been related to diet, and dietary changes have been a part of the management as well. Do you believe that this anti-inflammatory diet that we speak about plays a role in the management of autoimmune hepatitis? And also, sir, if you would like to mention anything about the connection of infections of the liver, such as viral hepatitis, with the diet playing a role in the management and what you see in the recovery of your patients.
You put too much on my plate. Let me handle slowly. But the first message I want to repeat, and I think it is important to solve the chicken and egg story. If you withdraw wheat, it is a GFD. The enzymes must return back to more than half of the normal if it is liver due to wheat. Let's say the AST, ALT were 80 or 90. And you have stopped wheat. Wait for 3 months. By the time the enzymes must return to less than like less than 60 or 50 with no other drug, just by wheat withdrawal. So that's a clear marker. No more tests are required that this was wheat or gluten-induced liver or hepatopathy, or what Dr. Neelam said, hepatitis. I'll put celiac hepatopathy because there are so many such injuries there. That's point one. Now, coming to whether it has a role in autoimmune liver disease, well, some connections have been laid that you have an HLA-DR2, and if I remember well, HLA-DR8, and these are connected with celiac. But asking me personally, autoimmune liver disease is an entirely different disease. It's a disease due to environment, and it is an insult which is, for example, patient has taken an antibiotic and it stays. Patient has taken a painkiller, it stays. There is some other food item. So there was a large survey from Australia which showed of 1,000 some hundred patients, it was the environmental insult in 70%, which was the cause of initiation of autoimmune. But wheat you're taking every day. It's not an acute insult or a sudden change. So somebody who is not on wheat and now takes wheat, you can have wheat allergy. In them, you can have autoimmune features, but not a person who has grown up with wheat and you say, oh, look, you have this problem. That would be a bit stretched out. The third, whether such patient should actually have connection, we connect the wheat to primary biliary cirrhosis, as Dr. Neelam said, or PSC or others. It is very difficult because they are diseases of the colon. So it is the colonic bacteria which has been spotted in the bile duct. So the 8 amino acids of the colonic E. coli have been lodged into the bile duct to produce PBC or PSC. But what wheat does is known as a molecular mimicry. For example, a child, please listen, this is a very, very important concept, and it is traditional for our Indian food for centuries. So a child or an adult gets a diarrhea. That is because of viruses, adenovirus, which is the most common virus. So you get a diarrhea, the diarrhea recovers. Now, intestinal epithelium takes 3 days to become new. But you start wheat on the day 1. Now, the 3 amino acids of gliadin and 3 amino acids of adenovirus are same. So when you have wheat, adenovirus is gone, diarrhea is there, you're finished. But when you give wheat to such a guy, then the body thinks, oh, adeno has come again. This is molecular mimicry, classical for celiac disease. Therefore, in Indian tradition at least, that never give wheat after diarrhea, give rice and curd, which I still feel is the best diet. So to prevent celiac, all of us, and especially pediatricians and maybe nutritionists, should never ask people to have wheat for a few days after an episode of diarrhea. And you said some diets can do that. Dietary inflammation, there is a what is known as a diet inflammation index, DII, and diet inflammation index is based on different diets, how much inflammation they cause. But I don't think in the case of wheat, inflammatory diets are there. Inflammatory diets are for obesity, they're for diabetes, maybe for other things, but not for celiac. Celiac is a specific inherited where you have injuries, and we should not precipitate it after an attack of adenovirus. mediated gastroenteritis.
Very interesting about learning about this molecular mimicry of the molecule that mimics adenovirus, and I'll always remember it after having an upset stomach. This anecdote. Thank you so much for that. So, Dr. Soin, quickly jumping to you as
Sorry,
well.
this is not anecdote. This is in the textbook of Schlesinger, our basic textbook of molecular mimicry. And the 8 amino acids from E. coli of the bowel going to the bile duct is known as K antigen. K antigen was discovered by an Indian called Kiran Das, and therefore the PSC part is by the E. coli of the gut, not of the bowel. I mean the stomach or duodenum.
So to continue with that, Dr. Sareen, I remember reading this in hepatology journal, I think 2007 paper, which did talk about that there were 60 patients of PSC, and they identified 1.6% of celiac disease in them. And so they did talk about that the patients, there was 4 to 8-fold higher chance of PSC and celiac. So that paper was trying to impress a lot about.
There was a beautiful review in hepatology, I can recall that. But let me tell you, now we do fecal transplant in most of our PSC patients. And the fecal transplant, FMT, makes a huge impact. In fact, the bile duct changes can reverse. So I am now convinced over the years that it is not the small bowel. The small bowel, it is the large bowel bacteria, and therefore the PSC is a large bowel related disease, not small.
Yeah, that's true. Because
more data is needed. More data is needed.
Great. So, Dr. Soin, moving on to you next, any comments on the current discussion that we are having, or any role of diet that you see in post-transplant patients that you usually advise them? Is it anti-inflammatory or anything related to wheat that you advise them or have seen in your cases?
So honestly, I don't advise diet related to gluten or wheat or so-called inflammatory diets. And of course, we all are aware that inflammatory diets are bad. But to tell you about post-transplant patients, the incidence of metabolic syndrome in post-transplant patients is very high, especially people who've actually had transplants for non-alcoholic fatty liver disease or NAFLD. So the incidence of metabolic syndrome for people, for the laypersons listening to this chat, that means if they're either too fat, if they have high blood pressure, they have bad lipids or high triglycerides, or low HDL, which is a good HDL, which is a good cholesterol, or have high blood glucose. So they have any of these 5 factors, they're called to have metabolic syndrome. Now, people who've already had metabolic syndrome and NAFLD prior to transplant will have a 60 to 70% chance of actually getting it back again. So obviously they have to be careful about diet. And people who don't even have metabolic syndrome or NAFLD prior to transplant, even they, among the adults at least, they have a 30% chance of actually developing a metabolic syndrome. And that is because of 2 or 3 things. One is because of the immunosuppressive medicines that they take. They are, one of them is diabetogenic. So some people will have mild to moderate diabetes after transplant. And the other is they simply put on weight because they feel hungry and they eat inappropriately and they don't exercise enough. So a whole lot of lifestyle advice is necessary for managing patients after transplantation. And the good diet is common to what all of us believe. The veggies and the fruits are good. Complex carbs are good. That means, with high fiber. And of course, fish is okay for the non-vegetarians. Fish is okay. Nuts are good for everyone. Seeds are good for everyone. Red meat is bad. Simple sugars and processed foods are bad. So this is general advice that we give pre and post-transplant patients. But especially, they are forbidden to have alcohol in high amounts. They're forbidden to have, like I said, the nose of the food and the diet I just said. After transplantation, they're advised to have good exercise. So obviously, a balanced diet has a huge role in in the ascertaining long-term health of these patients who've had liver transplants.
Thank you. Thank you, Dr. Soin. Thank you for that. And before we move on to our case studies, I have one question for Dr. Nilamohan ma'am also. So ma'am, although there is significant research of the association of dietary discretion and improvement of various GI disorders, do you see similar effects with diet on pediatric liver diseases also? I know we've discussed this, but if there's anything else to add on this, and any advice to the parents of children who are a case of various liver conditions, are there any dietary advices that you would like to provide to the mothers with children having pediatric liver conditions?
Yeah. So three things related to celiac. Earlier, there was a myth that if you introduce the celiac, the wheat late, it might help you to prevent the celiac disease. Then there was a myth if you start at 4 months and, all that. So I think eventually what we moved at understanding is doing the right things at the right time is the best thing to do. So introducing wheat at around 6 months, complementary feeding at that is what we've all said, because a lot of parents ask this question. Second is that it is very important, as Avi said, about now we want the parents to get it straight into their head that we say no to sugars. And of course, salt also, we are saying no to sugar for the first 2 years of life at least. The reason is that whenever you introduce sugar in life, you will always have, it's like an addiction and you always go ahead accepting that. But if you do not introduce vegetables at the right time in a child's diet, it's going to be very difficult for the child to accept that. So my message, to the audience is, please say no to sugars, cokes, cool drinks, and all this stuff, and focus on introducing vegetables and of course fruits in the child's diet in the first couple of years, because you need to get that taste right into it. And sometimes when the celiac patient is so undernourished, majority of the time, small cohort is obese. So when you end up and they start getting better, so whatever they eat, they start absorbing. So the parents earlier, they were not absorbing. So they were used to giving a child, say, 3x, and they continue to give 3x, but now the child is not absorbing 1x, may absorb 3x. So that's how they really tend to get obese also. So it's a very important message that you need to understand in the diet. When we are talking to you about a gluten-free diet, Ishi is there, she would say how important it is for a nutritionist to explain. It is just like, obviously people think wheat is a protein, so you're cutting down the protein. How do I replace it? Because rice is going to be all more carbs. So they're going to give you alternatives to ensure that there is enough replacement of protein in a diet, especially in an Indian diet who are vegetarian. So that's very important. And second, how to avoid getting overweight and obese, because you're ending up taking this alternatives and you're used to eating more and all that stuff. So this is the message I would want to give. And third message is, we tend to take things for granted once the diagnosis is made, and we think, oh, it's over with the doctors and the nutritionists in life. And that is like not really good, because it's a good thing at least to be in touch with the with the doctor. The doctor who has made your diagnosis at least once a year, and especially when the child is growing, the adolescent phase, the requirement, the need of nutrition, everything needs to be holistically looked into. And it's just not the diagnosis, my dear friends. It's like following it up throughout your life, and that lifestyle which needs to be reiterated. All of us love to be said, I love you, even if we know we love each other. So it's the same thing. It's very important to keep meeting those patients and understanding, and once in a while look into where things are going wrong. That's all I have to say.
Great. Thank you. Thank you for that, ma'am. And before we move to our case studies, any comments, Dr. Tom, on the topic before we move to 2 case studies that we have?
No, yes. One comment is it's just common sense that what you eat affects how your body works. And what you're hearing from all of the experts today is the importance of the diet. The most common source of inflammation in your body is what is on the end of your fork. What you choose to put in your mouth determines to a large degree the amount of inflammation you have. And everything we eat goes to the liver first to protect you. That's why we were made that way, is that the liver has a very protective quality to it. So you're hearing from all of our experts, it's so important what you eat. Very, very important to keep that in mind.
Great. Thank you. Thank you, Dr. Tom.
Just to interject for a short while.
Please.
I wanted to add few things from clinical experience. One, do not put all your eggs into celiac or wheat basket.
Yeah.
There must be a differential diagnosis. I at least remember 2 patients who have come with advanced liver disease, but all their life were treated with celiac because they had chronic anemia and they were being treated. So any patient with anemia, which is persistent or progressive and has low albumin, even if there is no ascites or pedal edema, I think we should look for liver disease rather than just celiac. So anemia and low albumin is one. Second, you raised a point of cryptogenic cirrhosis. I totally think that this basket has now been solved to a large extent by new autoimmune markers or MAFLD or by, but still about 10% of the patients we don't understand. And they're increasing. So I think there is a need to very scientifically look into what is this cryptogenic cirrhosis. Does it have any macrophages like CD14? Different types are there which can cause liver injury, which are from the bowel. The third part of the important part of this is that a patient who is on GFD for a long time and he has liver disease, and you put a liver disease patient on GFD, he will be totally bankrupt. He will not have any zinc or folate. He will have, as it is, he has all these low. So additional supplementation must be given to a suspected celiac and a definite liver disease patient. So nutrition in these patients. So if a liver disease patient is there, to put him on GFD, you should be extra cautious. Don't treat celiac that way in a patients with underlying chronic liver disease.
Yes, Dr. Tom, please go ahead.
That is a very important point to bring up, is that there is a danger in the gluten-free diet. And the danger is if it's done incorrectly and eating a bunch of gluten-free products that are not healthy for you. That is why the Celiac Society of India is so important in the conversation, that when you do a gluten-free diet correctly, you resupply the nutrients, the vitamins and minerals that you may be low on. But you have to learn how to do it correctly. You cannot substitute gluten-free bread, gluten-free pastries, gluten-free cookies for the old bread that you were eating, the cookies. You cannot just substitute and keep living the same lifestyle. That's very dangerous. That you have to learn how to do it correctly. And for that, I would pass the baton to Ishimam.
Great. Thank you, Dr. Tom. So, Ishimam, we've been waiting for the 2 case studies that we had discussed, and both Radhika and Tirath have also been waiting very patiently. Thank you so much, Radhika and Tirath, for taking out time for us. And very exciting to understand your journey as well. And if Ishimam could just broadly give us an overview and then take it forward from here.
Yeah, thank you for that, Arjun. And some excellent points have emerged in this session. I just like what Dr. Neela Mohan also said about introduction of wheat at 6 months, and just a qualification that we would like to delay the introduction of wheat in high-risk patients up to 1 year. And the high-risk patients would be the ones who have a family history of either autoimmunity or celiac disease or other metabolic disorders which are related to wheat. So those families should take care, or if there are other problems as well. So there would be merit in doing that. Again, these are early days and nothing can be really etched in stone. Secondly, Dr. Tom has also brought out the fact that, and so also the others, that that a gluten-free diet is not a panacea, and it should not be just it becomes a fad when everyone just starts taking alternatives, and they move to taking flours, say even millet flours, which are being produced in common flour mills, in mills where they are processing wheat or other grains which are prohibited. So that is a very big point which needs to come out of this discussion. And I'll have these, the 2 case studies will be reflecting these points as well. That when you move to a gluten-free diet, it needs to be done under supervision. It must be a healthy gluten-free diet. It must be rich in the right vegetables and in the fruits and nuts and good fats and adequate protein, and also provide nutritional supplements wherever needed. And we do see the gut improving, we see the absorption improving, and the blood work is very, very encouraging. Mostly we get 100% results. So, but of course, like the bottom line is doing it right. And moving on to the 2 case studies, and there are so many of them that have got treated with liver disease, and we are not differentiating one from the other. We are just going to be making a few points through these case studies. So the first one is Tirat Mehta. Tirat Mehta has been, when she came to me, she was 43, and I think she's about 48 or 49 now. And all her life, she has suffered from digestive problems, vomiting, and loose motions and nausea from birth. She says from birth, so as far as she remembers. And she has also had a history of anemia. She has been skinny and never really put on weight. She was put on to antibiotics, anti-anxiety medicines, all kinds of antacids and anti-vomiting medicines, and that's been her life. And I'm going to open it to her for her to explain what she went through and where she is today. Her hemoglobin was not more than between 7 and 10 all her life. So Tirat, can we have you? Dr. Arjun, can somebody in the back get her on the camera? Tirat is also now into food, and she's preparing all kinds of meals for people, and she has 2 children, and is not on any medication as of now for the last many years, and her hemoglobin is 13 with no pills, nothing.
Tirat is right here. Tirat, can you hear us?
I think
you're on mute. Tirat, you're on mute.
She is not on mute, but her audio is not working right now.
Okay, so maybe by the time, and the other, aspect of her blood work was a very low vitamin B12, which is expected. And so what happened to her, she was around doctors most of the time, between hospitals and doctors, and was miserable, had gone through many endoscopies and colonoscopies. And she's somebody in distant family. So I used to get to hear about her condition, and I kind of urged her family to send her to me to figure out what's going on, and let's help her through food. And she always said, my doctors have told me that I don't have celiac disease and it's nothing to do with food, and so on and so forth. Till finally, the one last endoscopy, they said, oh, you have you have a sprue, you have a tropical sprue. And then somewhere she was, she came to me, and her celiac marker was very, very, borderline, never really a positive. And I know Dr. Tom can explain that very well after we finish. And so finally, when I said, listen, you may have what we call non-celiac wheat sensitivity, irrespective, just change your food, change your flour, and let's see how you feel. And that was a turning point, the transformation in her body, her vomiting, her loose motions, everything vanished within a few months. Her blood work started looking normal. And here, the liver connection comes very interestingly, because when she came to me, her liver LFTs were not deranged. But when she started the gluten-free diet, she developed a high SGPT, SGOT, both were deranged to 100 and 300. And here I said, why is this happening to you on a gluten-free diet? And she swore that she never ate anything besides what she was told. But finally, we figured that she had moved to taking corn. And, corn is a grain which is gluten-free. However, as Dr. Sareen pointed out, molecular mimicry, corn also mimics wheat, and it is on the red flag list of grains to be avoided with a wheat-free diet. And so we told her to stop the flour with corn, and within 2 months, her enzymes came back to normal, and she has been having normal LFTs ever since. But again, in the last 2 months, she changed her flour mill, and she changed her flour, not realizing that that was a flour mill which was being used for corn also. And again, she developed symptoms, and we did her blood work, and again, her SGPT had gone up to 100, and now, it's coming back to normal. So this is the point I want to highlight, 2 or 3 very important points, that this lady is also now gaining weight. She is now trying to watch her weight, like Dr. Neelam said. You begin to start absorbing food. And so she was otherwise non-obese, and she had low hemoglobin, yet in the attempt to prove celiac disease from a positive serology, she was missed out as a candidate for a wheat-free diet. And today, she is leading a normal life. And every time the doctor told her that, she was also very anxious, and anxiety can be a part of a deranged microbiome in the gut. And so the doctor just told her, it's all in your head. You don't have a wheat-related problem, and you are, it's just in your head. So you don't have celiac. So I wish she was here to validate what I'm saying, but I've really put down the most important points, that she was missed out, and she was, even though the fact that she had vomiting and all that from birth, and she's got 2 children and who she manages very well, and all of that. Now, we have the second case study in the Radhika Mehta. They both happen to be Mehtas, sharing the same surname. And she came to me with a diagnosis of autoimmune liver disease. And this was after her first baby at 31 years of age. And she was also non-obese, non-alcoholic. Even Tirath was non-alcoholic. And she had history of digestive problems, a gallbladder issue, typhoid, jaundice, tuberculosis, osteopenia, all the things that we can associate with immunity and malnutrition. And she was on steroids when she came to me, and her hemoglobin was okay, about 12.5. And she had deranged LFTs. So I said, let's do a trial and let's do the food sensitivity test. But forget the test, we'll just do the validation through your LFTs. So we put her on a wheat-free diet. We put her on an anti-inflammatory diet. We gave her the supplements needed to rebuild her gut microbiome. And within 2 months, Radhika's levels of, the LFTs started coming down, and her complexion, which was dark when she came to me, started improving and lightening, and all of that, changed the way she was. She was always fatigued, and, her primary complaint was tiredness and low-grade fever. So all that within weeks had vanished on the diet. So the point is that, these are cases where we can, and she had tested negative for celiac. So she had non-celiac pathology. And if Radhika is there, can we have Radhika?
Yeah. Hi, Ishi ma'am. Thank you so much for giving me this opportunity. And I'm very, very thankful to all of you also. So it was, I'll just share my journey, how this whole thing went, So it was 8 years back after I delivered my first baby that I experienced a lot of body aches, low-grade fever, problems with my digestive system, and extreme fatigue, to that level that doing daily chores was also a challenge. So after 1 year of blood tests and rounds to my general physician, it was diagnosed that there is some problem with my liver, as my SGOT, SGPT in every test were high, almost touching 200. So it was then that I went to ILBS hospital, and Dr. Serene, and I just call him my angel doctor, and he finally diagnosed that it is autoimmune hepatitis, which was affecting my liver. So he prescribed me with steroids to suppress and to avoid flare-ups of the disease. Though I started feeling little better, but I had to deal with side effects of steroids still. So after 3 to 4 years of taking all those medicines, I asked Dr. Serene in one of the appointments that if I can adopt some alternative way of healing as well. And he was quite supportive of it, thankfully, and he always suggested me to do exercise and running, and diet changes also. He supported me. So it was then that I went to Ishi ma'am for a consultation, and when she told me the list of the things I can't eat, including wheat or our most staple food, roti, so I was very disheartened at first, and I didn't want to believe that how can suddenly the same roti is not suiting me, which I'm eating since my birth. And also, how is it suiting everybody else around me? So all those questions were there, though I had no other option because I wanted to get rid of this problem. So I started believing Ishi ma'am, and I also did a lot of research and read many books which gave me enough logics and science behind foods that we eat. And then there was no looking back. So I believed Ishi ma'am and followed the diet to the T, so I didn't cheat at all. That means, so slowly my SGOT, SGPT levels, just like Ishi ma'am shared, that they started improving, and gradually in 1.5 years of that consistency, my tests were absolutely coming back to normal. So not only this, I was also feeling more energetic, my skin became clearer, and I was looking just like I used to look before my marriage, So then eventually I took a decision of leaving my steroids without consulting Dr. Serene. So sorry, Dr. Serene, here on this platform also. And I did this because I wanted to see it for myself, that if changing my diet and working on my lifestyle has really worked. So then post 6 months of still getting normal blood tests without any medication, I took a final consultation with the doctor, fearing that he might scold me, So, but to my surprise, after looking at my reports, he said that please continue with what you are doing, and you are free of the disease, and also try for another baby now, because I asked him this question. So, and I'm very happy to share that, I have a second child now, and my LFT also comes normal because I still get them tests whenever, after 3 months every time. And with this, I really want to thank Ishi ma'am and Dr. Serene for always supporting me and giving me hope during this process. So now that I was really confident that one can heal by changing diet, lifestyle, and also by changing thought process, which I understood by reading a lot of books and doing my self-Reiki healings, etc. So now this had become my mission to heal others' lives also, with which now I have launched a platform where one can do bookings of nutritionists, psychologists, and healers by the name of Pure Jiva to heal many, many lives in future. So this has really become my mission, and thank you so much, everyone on this platform, for giving us more insight on this. Thank you so much.
Ishi, what about, did she undergo, you said that her serology, both TTG and anti-endomycin were negative?
Yeah, yeah.
Did we do her gene testing like HLA, DQ2, DQ8?
I don't recall.
You don't remember, it's okay.
But she had an ANA positive, that I know.
She was ANA type 1. And what
Yeah.
was the titer? 1 in 40, 80, 160? What was the titer?
I have to look at that file. It's been a while now.
Okay. And the other thing is that did she undergo a D2 biopsy?
Biopsy, yeah. So
Duodenal
one
biopsy, not a liver biopsy.
Duodenal
liver
biopsy.
biopsy we have done.
Yeah, so there is, see, you have to just understand a little bit things, because I mean, of course, it's so nice to listen to your story, but even in type 1 autoimmune liver disease, what you had, there are a fortunate few 30% whom when we get normalcy and we stop, they do not have a relapse. But the others have a relapse. So I don't know, you're the fortunate one who did not have a relapse, and the other can be number one. Number two, it would have been great, as Ishi and Tom will talk about it. There are two conditions. One is the celiac, and one we call as the non-celiac gluten
NCG.
sensitivity, which I was talking is not the it is not the autoimmune type, but it is the third variety, the food allergy, and the that we talk about, that can give rise to improvement in patient. But in that, the serology comes negative, and we see in the biopsy some borderline changes in the liver biopsy. So your case is really very exciting, and I totally support. It's not possible always to do everything, but it would have been nice to know what your HLA is and what
You
your
can still do the HLA.
one biopsy. Sorry.
HLA can still be done.
Yeah, HLA you can do, but her biopsy we won't know, and whether she was a type 1, which she went into remission, and we just need to chase and keep being sure. And if you believe in Ayurveda, it's what Ishi says. Everything in the Ayurveda, they talk about the gut, and the Sushrutas and Ayurvedas, and the Hippocrates, father of medicine, said everything starts from the gut. So yes, there's so much in the gut. It's a Pandora, and but having said that, the message should not go across that if you have liver enzyme derange and you take wheat free and you'll get okay. So that message also should not go, as
Absolutely.
Dr. Sareen highlighted.
Yes.
I mean, everything should be understood in a very logical manner with the experts.
Yes. I'd also like Dr. Tom here. That was absolutely very, very appropriate, Neelam, and very important. And I think she can do, for sake of records, the HLA, DQ2 and DQ8 testing. And regarding the gut situation and the leaky gut and the typical changes in celiac, Dr. Tom, we were talking the other day and had some very interesting data on how to interpret serology for celiac, whether it's TTG or endomycelial. Dr. Tom, could you share that piece of information?
Yes, of course. The test that is used in the world today, blood test to identify celiac disease, is called TTG, tissue transglutaminase. And it's a very good, accurate test. And the sensitivity of the test is over 97 to 99%. That if you have celiac disease, which means total villus atrophy, meaning the inside of your intestines is completely worn out, then this test is very, very accurate. But if you have celiac disease and you're not at the end stage yet, it takes about 7 years once that inflammatory process begins, usually before you get to total villus atrophy. If you are at an earlier stage of development going towards that end stage of total villus atrophy, the TTG test, its accuracy is 27 to 32%. It's wrong 7 out of 10 times, and we'll say there's no problem. So if you are at the end stage, it's very, very accurate. But you cannot use that blood test to determine if a person is on the celiac spectrum, because it is only accurate when you're at the end stage of that. That's a very important concept to understand, because so many of our research papers that show TTG is very, very accurate for celiac disease. Well, the way they prove that is that they went and they look for people with celiac disease, and then they check their blood. Smart thing to do. But the diagnosis of celiac disease, those people all have total villus atrophy. They are at the end stage. And when the researchers go back and they look at people at earlier stages, it's called MARCH-1 or MARCH-2, that the TTG test is wrong 7 out of 10 times.
Exactly what happened to the case study before Tirath Mehta. That was her case where it was clearly a wheat-related issue, perhaps query celiac, because they found it looking like tropical sprue. You know, she was just not getting the right treatment because they were waiting for a positive serology. And here also there is a debate today on doing an endoscopic biopsy when you have a certain level of the TTG. So if it's more than a certain number, Neelam would be aware of that, that you can avoid a biopsy and when there's a clinical suspicion which is high. So yeah, all those things need, you know.
Yeah, so basically in India, we don't go for that because doing a biopsy is much more cheaper and reasonable. Abroad, because you don't get the gastroenterologist, they had suggested that you need to have more than 100 anti-TTG, and then you have to have anti-endomycin, and then you have to have genetic positive, all that scenario. So the cost is quite huge, and the guidelines in India stick to the fact, because there are other causes which can give rise to other issues, like GRDSs can give rise to false positivity. So in India, our guidelines still suggest that doing a biopsy is most appropriate.
Yeah.
So I would like to thank you all for that lovely, interesting. I mean, it was so awesome. I'm so grateful to Ishig and the Celiac Society of India, Tom and Arjun. So nice to see you all, at least on this platform. It was really, really a wonderful discussion, and I'm so appreciative of Radhika, her name is Mehta. I couldn't. So sweet of you to give back to the society. Stay blessed and keep on the good work.
Yeah.
Thank you, ma'am. So I think that Dr. Serene, sir, did you want to make a comment? I saw your hand was raised.
3 points.
Ji, sir.
First about what Dr. Tom said. I want to say in patients with liver disease, the TTG is not very sensitive because the liver patients already have a very low IgA. So a low IgA, so TTG IgA may not be. In a healthy group, it may be good. 2 is that what you were telling, MARCH-1 or 2 is subclinical celiac, where you have the serology positive but may not be pathology positive when it takes. So at least 10 times more people are subclinical than actually have. And therefore, serology should not be ignored, even if it is not 5 times higher or 10 times higher, which is very suggestive. I think we should take a subclinical celiac and if possible biopsy, but otherwise we should warn them or protect them from getting further injury. Now coming to Radhika, I remember her case fairly well and I thank her for sticking. We always have 2 biopsies at the beginning and autoimmune score has to be 7/8 or so. And then at the end of 2 years, we would repeat a biopsy. I guess she got 2 biopsies done. And then if the second biopsy has clinical, biochemical, and histological remission with a reduction in IgG and ANA, we say, yes, this patient has gone in remission. And if somebody is in remission, as Dr. Neelam also said, there is a chance of relapse, but maybe she had lucky. And she was very lucky to have second pregnancy because pregnancy decreases autoimmune. Pregnancy decreases celiac. It's a very, God's design of overcoming these things. So that was very good. And I must say, Ishi and her team has done splendid. You as an ambassador would do splendid, and Arjun. So I thank you all. And it was a pleasure joining you and learning from each one of you. Thank you.
Ditto.
Thank you for having participated. Thank you so much.
Thank you. Thank you, everybody. We have just a couple of audience questions, and if I can request Neelam ma'am and Serene sir, just give us a few more minutes. And
start from the phone because I have
Sure,
to
sure,
reach my gym. Otherwise,
sure,
I'll
sure, ma'am.
I'll shift
Sure,
over to the phone.
absolutely.
And can I request your team people to give the connection on the
Sure,
phone, that thing?
sure. Arjun, can you share the
Uh,
phone link
It's
with?
already shared on the WhatsApp. So, ma'am, you can just access, you can log out from here and access it on the WhatsApp group, the link that I have shared, and you'll be able to log in on your via your Zoom from there.
So we'll take a few of the questions that came in on the chat, and this is by Professor Dr. Pranab Kumar, and he's asked something that I have read about before, and I think Sareen sir would be able to guide us about this. Um, I think Dr. Sareen
Dr. Sareen
has.
is not here, so
Okay. Sure, sure, sure. So then, 1 second, let me just. Because I think Ishi ma'am or Dr. Tom can take this one. A patient was H. pylori positive, got treatment, but still had stomachache. Got allergy test done. It was positive for wheat, but TTG negative. So I think Ishi ma'am or Dr. Tom, do you want to take this?
Yes, that's a classic. It happens so often, and it's what we were just talking about. The TTG will be negative if you are, it has a strong likelihood of being negative unless you have total villus atrophy celiac disease. Then it will be positive almost every time, 97 to 99% of the time, if you are at the end stage of the disease. But if you're at an earlier stage, it often comes back negative. And we have to remember TTG is the test for end stage celiac disease. It is not a test for gluten sensitivity. We have to remember that celiac disease is one manifestation of a problem with wheat for the individual. Someone else may not have the genetics where their problem is celiac. For them, it may be multiple sclerosis. It may be rheumatoid arthritis. It could be attention deficit in your children. It could be autism. That a sensitivity to wheat can manifest in many, many different conditions. Historically, the medical profession has used TTG as the test for wheat. It's not the test for wheat. It's the test for full-blown celiac disease. And that's a very important point to remember.
Thank you. Thank you, Dr. Tom. So my next question, I'll address that to Ishi ma'am. And Megha is asking this on the chat. My daughter is 5 years old and she does not feel good after eating a whole wheat roti. I tried jowar, bajra, but the same. Any advice to her, Ishi ma'am, if you'd like to address that?
Yeah, certainly she deserves some kind of other testing. She must do the further food sensitivity testing, and jowar may or may not work. It is gluten-free, but if the child's lining is sensitive, too much of fiber or coarse grains can be an issue. So maybe she should try a rice-based diet for a few weeks and a month or two, and then see how the child feels. And if she is doing this, then cross-reactive grains also must be addressed, and she must take away corn and soya also. And oats are in a query situation, so she must watch how the child feels with oats, but because it is also one of the grains which cross-reacts. So yeah, she should basically keep a food diary and a symptom diary and do the testing.
Great, great. I think any other questions from the audience, Ishi ma'am, that you suggest that we take, or anything else?
We have the Tirath. She says she's here. Would you like to just get her in for a few comments?
Oh yes, absolutely, of course. Tirath, could you say something?
Hi, can you hear me?
Hi. Yes,
now?
perfect. Yes,
Okay.
audible. Go ahead.
Yeah, I think so. We went through my case history. Unfortunately, at that point of time, there was a problem with my audio, so I couldn't be heard. Yeah, so I'm really, really grateful to Ishi auntie because she kind of saved my life. She really did. I've struggled my entire life with this problem, And it's not been diagnosed for 43 years of my life. I mean, I went into hospital multiple times, and it was all those times the doctors would just discharge me saying it's all in my mind. And there was a point where I was, even a sip of water was something that I could not retain. I would just bring it up. And I went through colonoscopies, endoscopies, stomach scan, everything. And the blood tests in my case do not show positive, right? They don't show a gluten allergy. So thankfully, Isha and I went for a 6-week antibiotic treatment for tropical sprue. And I was put on so many anti-anxiety pills, which played havoc with my brain, and thankfully at 43, Ishi auntie came into my life, and she just said, you come and meet me and we need to see you. And I think it's gluten. And then she did the food allergy test, which is where it came out that, yes, I was allergic to wheat. And she put me on a gluten-free diet, and she told me to stick to that. Everything was working well till I tried to experiment myself. There are so many of these gluten-free flours that you get in the market. And like Dr. Brian said that, you shouldn't try and replace, but the human brain being what it is, you do want to eat all those things. So I went ahead and experimented and picked up a flour which had a high level of corn. And that created so much inflammation in my liver. I mean, I usually walk 6 to 7 kilometers a day. But despite that, I ended up getting a fatty liver. My SGOT and SGPT levels were so high. Again, she came to my rescue and said, please tell me, what are the flours you're eating? And, from there, she was able to figure out that corn in one of the flours was really causing this reaction in my body. And the minute she took me off that, I was feeling much better. The inflammation, I had gained so much weight because I was eating that flour. The minute I stopped eating that flour, I lost 5 kgs immediately, and I felt healthier. I felt much better. And so that's something that I've now learned, that I really have to stick very closely to the diet that she's prescribed, and not play around with it. So it means controlling your urges, but that's something that you need to do. You can't play around with this because the body reacts immediately, in my case. Yeah.
And your hemoglobin is up now, Tirath.
Yeah, my hemoglobin is much, much better. I'm off all kinds of antacids or, anti-anxiety pills and all. And yeah, I'm really, really grateful to her. Like I keep saying, she saved my life in every aspect.
Thank you, Tira. That is indeed something that we'll conclude the session with. And Dr. Tom, any concluding remarks from your side before we close?
Oh, thank you. Earlier, one of our experts referred to an article in the medical journal Hepatology, and it was in November of 2007. I know that article very well. And they talk about, today's topic is about the liver. And the takeaway here, I would suggest, is that there's 2 ways that the liver can be damaged if a person has a sensitivity to wheat. One way is that wheat causes inflammation in the intestines for everyone that eats it, whether they feel it or not. And there's a lot of science on that. But that inflammatory process, those inflammatory molecules can go to the liver and cause inflammation in the liver. So that's the first way. The second way is the autoimmune mechanism. And someone referenced it earlier by molecular mimicry. And then the antibodies can go to the liver and damage the liver. But the bottom line is that wheat is petrol on the fire for all of us, whether we feel it or not. And if you have the genetic sensitivity, it will affect your liver. If you have a different genetic sensitivity, it will affect your thyroid. If you have a different genetic sensitivity, it'll affect your brain. But the mechanism is the same. So I would recommend and suggest that everyone here today take a look at the website for the Celiac Society of India and just begin exploring some of the information a little bit every week. Spend an hour a week to learn more about how the foods you choose can fuel inflammation in your gut, change the good guys in your gut, and you lose that balance of good guys to bad guys. The more inflammation you have, the more bad guys you get in your gut, and then the entire inflammatory process that goes from there. Thank you.
You've said it all.
Thank you, Dr. Tom. I think that was the perfect conclusion. And unless there's something else from Neelam ma'am or Rishi ma'am, I think we can proceed to conclude.
Yeah, so I think what we learned today is there is nothing 2 + 2 4 in medicine. You need sign investigations, the doctor's opinion, because there are some simple things like, like Tom said, that only in advanced disease your TTG will be. It is also not true all the time. So there are ifs and buts, because we've had patients where even with MASH 1, your TTG is very raised. So we are just broadly giving the audience some points, but at the end of it, every point has to be carefully seen in the jigsaw. And it's totally a delight to be today on this podium with Ishi and Tom and Arjun, and to share the wisdom pearls with each other. Thank you very much for having me over.
Thank you, Neelam. And just one last point before we sign off, Arjun and all the panelists, that whether it is celiac disease or whether it is non-celiac wheat sensitivity, the audience must follow the diet to the T. There is no cheat allowed in either. There is no cheat day, so please get that message very clear. If you're following the diet, it has to be uniform across.
Yes, you cannot be a little pregnant. And you cannot have a little wheat.
Yes.
If you've crossed the line and your body has a problem with wheat, you can't have it. There's no such thing as cheat days.
Yes, absolutely.
Thank you, everyone.
Thank you. Thank you,
Thank you.
everyone.
Thank you, everybody. I'm
this
sure
wonderful
Arjun
session.
Mahajan is thinking, what about the weekend beer then? Over to you, Arjun.
I have actually taken my point from Ishi ma'am. Is off my diet, and thanks to fitness goals, alcohol is off my diet as well, completely. Really helps. And I don't eat, right? But thank you all, ladies and gentlemen, for sharing your views, experiences, and it doesn't feel like it's been 1.5 hours. This has been our longest webinar, and it could go on, and we still have a lot of people on board till today. Thank you all so much. We look forward to the next episode coming up in a month from now. Thank you all.
Thank you, Arjun.
Thank you.
Bye-bye.
The link, we will be sharing the link on Novivell as well, and we'll be putting it up on the JMitra YouTube channel as well, the video, and that's free to view and watch. Thank you.
Thank you.
Thank you.